In this beginner's video, we'll answer the question, when do I enroll in Medicare? And we'll review the Medicare enrollment periods. I'll review all 6 enrollment periods, including when you can enroll for the first time and when you can make plan changes in the future, so you can save money and get the best coverage for you. Stay tuned because I'll also share how to avoid costly late enrollment penalties. Hi, I'm Renee Van Staveren. I work with hundreds of Medicare agents across the nation, and I lead Medicare education at Connie Health. Let's jump right into it. When should you enroll in Medicare for the first time? The best time to enroll in Medicare for the first time is during your initial enrollment period. This is when you should apply for Original Medicare Part A, hospital insurance, Medicare Part B, medical insurance, and Medicare Part D, prescription drug coverage if you don't have credible coverage from another source. Your initial enrollment period lasts for 7 months. It includes the 3 months prior to your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday, 7 months. Now, whether you need to take action during your initial enrollment period, it kind of depends on if you are 65 and already collecting Social Security or if you're continuing to work. If you are 65 and you're already taking Social Security Administration retirement benefits or railroad retirement benefits, you would be automatically enrolled in Medicare Part A hospital insurance and Medicare Part B medical insurance. Now, once you get your red, white, and blue card for Medicare Part A and B, that's when you can then meet with a local licensed agent and review your Medicare Part D prescription drug coverage options if you don't have credible coverage from another source. If you don't have prescription drug coverage from either Medicare or another source, you could face late enrollment penalties when you do enroll in Medicare Part D. So please make sure you take this extra step and meet with a local licensed agent to review your plan options. At this time, you can also review Medicare Advantage or Medigap plan options if you'd like to add these to your original Medicare. Now, here's where it might get a little bit more complicated. Maybe you're turning 65 and you're still working. Although you could be eligible for Medicare Part A and B when you turn 65, it does not mean that you have to sign up for it. If you have health insurance and prescription drug coverage that is equal to Medicare's coverage, you may not need to take any additional steps. You could, in fact, delay Medicare enrollment. However, there are some circumstances where you would want to enroll in Medicare even if you have additional healthcare coverage from an employer. Now, in some cases, Medicare can provide better or more cost-effective coverage compared to your employer insurance. Many people who are Medicare eligible think that they have to give up their employer insurance if they enroll in Medicare, and that's simply not true. We recommend that if you are 65 and you are still working, that you compare your employer's healthcare coverage with Medicare options. A local licensed Connie Health agent can provide a free healthcare plan review comparing your employer coverage to Medicare plan options to ensure that you're getting the best coverage for you at a cost that you can afford. Keep in mind that if you are currently working and you choose to delay Medicare Part A and B enrollment, and you don't have equal or credible coverage, then you may need to pay a late enrollment fee when you do decide to enroll in Original Medicare. If you'd like to learn more about the initial enrollment period, we wrote an article all about it, and you can find it linked in the description below. I truly hope that you're finding this video to be valuable. If you are, take a moment and hit the like button below, and watch this video till the end, where I'll share more helpful links to support you on your Medicare journey. Now, let's get back to the video. Now, if you miss your initial enrollment period, all hope is not lost. You can still apply for a Medicare, but it will just likely cost you more. The next enrollment period where you can enroll in Medicare for the first time is your general enrollment period. Now, unlike the initial enrollment period, which is really about your birthday, the general enrollment period is a static time frame that happens annually, January 1st to March 31st. During this time, people who are Medicare eligible and miss their initial enrollment period can enroll in Medicare for the first time. Although you would be enrolling between January 1st and March 31st, your actual Medicare coverage effective day would be July 1st. So there could be a delay there in your coverage. So that's definitely something to keep in mind. Also, because you enrolled outside of your initial enrollment period, you would likely have late enrollment penalties. So in the long run, enrolling in the general enrollment period will cost you more. We wrote an article about the general enrollment period as well, and you can find that article linked in the description below. Now on to the last enrollment period for enrolling for the first time. And this one is very specific to a type of plan. Once you are enrolled in Medicare A, B, and potentially D, you may want to explore Medigap or Medicare supplement plan options. Medigap plans help you afford out-of-pocket expenses that original Medicare doesn't cover. Similar to Medicare Part D enrollment, which you should do in your initial enrollment period, Medigap eligibility and enrollment is based on when you are 65 years old and you are enrolled in Medicare Part B. The Medigap open enrollment period is a 6-month window, and it begins on the first day of the month that you are both 65 years old and enrolled in Medicare Part B. The Medigap open enrollment period is the best time to apply for a Medigap plan because it'll get you the best cost and ensure your enrollment. During the Medigap open enrollment period, insurance companies must sell you a policy, regardless of your medical history or pre-existing conditions. This means that you can't be denied coverage, and you would not be charged more based on your health conditions. The Medigap open enrollment period is critical because it is one of the only times where you have guaranteed issue rights. If you miss your Medigap open enrollment period, you could be refused a policy or charged more due to medical underwriting. To learn more about the Medigap open enrollment period, click the article link in the description below. Now that you know the 3 critical time periods when you can sign up for Medicare plans for the first time, let's talk about when you can make plan changes in the future. I think these are really critical because you don't want to set and forget your Medicare plan. Your healthcare is always changing, as are Medicare plans. This enrollment period, I think, is one of the most critical, maybe second to your initial enrollment period. It's the annual enrollment period. The Medicare annual enrollment period, sometimes referred to as the Medicare open enrollment period, runs from October 15th to December 7th annually. We recommend that anyone enrolled in Medicare mark this on their calendar. You should have your Medicare plan reviewed at least once a year. Your Medicare plan could change its contract with Medicare. Suddenly, the doctors that you have relationships with or the prescription medications that you need may no longer be available. New plans could also become available in your area, ones that offer maybe a lower cost or better benefits. Every year, new Medicare plans come out to compete. And so this is really in your favor. So you can always be on the lookout for a better plan than you currently have. Also, your health or budget could change, which could make the plan that you're currently enrolled in not work for you anymore. These are just some of the excellent reasons why you should have your plan reviewed during the annual enrollment period. To learn about the plan changes that you can make during the annual enrollment period, read our annual enrollment period article linked in the description below. Now, if you choose to enroll in a Medicare Advantage plan, once you've enrolled in Medicare Part A and B, then you also have another enrollment period to make plan changes. This is the Medicare Advantage open enrollment period. The Medicare Advantage open enrollment period is not for newly eligible Medicare beneficiaries, like those who want to enroll in Medicare Part A, B, or D for the first time. It's also not a time to enroll in a Medicare Advantage plan for the first time. The Medicare Advantage open enrollment period is only for individuals enrolled in Medicare Advantage and have a plan that's not really suiting their needs. The Medicare Advantage open enrollment period runs from January 1st to March 31st every year. Something that I like about this is that you can review your Medicare Advantage plan during the annual enrollment period, test it out for a little bit, make sure it works for you. And if it still doesn't, then you have the Medicare Advantage open enrollment period to make another change. We've shared 5 reasons why you might want to make a Medicare Advantage plan change in our Medicare Advantage open enrollment period article, and that is linked in the description below. The final enrollment period is the special enrollment period. A Medicare special enrollment period enables you to make a plan change outside of a standard enrollment period, like the annual enrollment period or the Medicare Advantage open enrollment period. There are 3 primary reasons why you might be eligible for a Medicare special enrollment period. First, if you are currently enrolled in Medicare and have a qualifying life event. Second, if you're currently enrolled in Medicare and have a 5-star special enrollment period. Or number 3, you don't have Medicare and you've lost your credible coverage from your employer or another source. This is an exception, for example, if you need to enroll in Medicare if you lose your job. To learn how to avoid gaps in coverage and costly late enrollment penalties, read our special enrollment periods article linked in the description below. In this video, we answered the question, when do I enroll in Medicare and what are the Medicare enrollment periods? I reviewed the 6 enrollment periods, including when to enroll for the first time and when to make plan changes. Connie Health is here to support you throughout your Medicare journey. If you want more videos like this, subscribe to our channel. For more Medicare videos for beginners, see our Medicare for Beginners playlist in the description below. Until next time.